Hello? Let's, I, I'm trying to find how to do that. Let's see. Um, let's see. Oh, I'm sorry. I see. I just don't know how to stop it. Okay, bye.
Good morning.
Hi.
Good morning, Steve. This is Thomas Henderson.
Good morning, everyone.
Good morning.
Good morning. Good morning, Elias. Can you guys hear me?
Yes.
Oh, okay.
I can't
Good
hear
morning,
anything.
Dr.
Can you
Johnson.
hear me?
How are you?
There we go.
Steve, can you hear me now?
Yes. Hi, Thomas. Hey, good to see
Okay.
you.
Good morning.
Yeah, thank you.
Well, it's a pleasure to finally see everybody face to face, but we're getting a little bit of feedback there, Elias. I'm not sure what that's from.
Merle, can you at least mute your? You see in the bottom. Okay, Merle, you see in the bottom of the screen. There's a camera and a microphone. You need to click on each of those and get off the screen and get off the microphone. Thank you.
Okay. And Steve, is Merle going to be joining us as a presenter in substitution for someone this morning, or?
No, it was a mistake.
Okay.
She clicked on access button for the camera.
Okay. All right. No problem at all. I know that I had the list of people that are actually joining us as speakers on here, so I just wanted to make sure I was not missing anybody. So,
And Elias, hi. We don't know each other. Are you on this presentation?
Hi. Yeah, I'm with the 100 Black Men, and
Oh,
I'm
hi.
just
Okay.
yeah,
Hey,
yeah.
nice to
So I'm
meet you.
gonna kind of be like an admin for this session.
I need it. I need it. All right.
Yeah.
yeah, Elias will be a very important part of this session to ensure that we function properly this morning. We've had some technical difficulties along the way, so we'll even say this to you in advance that if there is some type of difficulty, Elias will do his very best in order to make sure that we can get that fixed right away. But Elias, I do hear something still, kind of like as a feedback. Is anybody else hearing that as well? Okay, so I'm not sure where that's coming from.
It happens when you speak, Thomas.
Yeah, I noticed that as well too. So, and I'm not logged on twice, as far as I know.
Yeah. Let me try maybe muting you and then unmuting you. See if that changes anything.
Okay.
So, Doctors Martins and Tinwala are looking for a link for the backstage, to get backstage. Can we help them? Can we give them advice about how to get to where we are?
I don't have the backstage link.
Yeah.
Hold on.
I mean, how did I get
Let me
here?
try and get. Let me try and get that. Let me ask.
And Representative West also.
So I see that Representative West is trying to access. So I don't know, Elias, do you have direct contact to Eric Meredith?
Yes.
Okay. If you could, and for those of you that are kind of like waiting right now. If you can be a little bit patient with us, because we do have 5 presenters from IPS that will be a part of us today. So, and we just got some kind of funny feedback right there. Well, you know, this all goes as a part of being in Chicago. We had snow yesterday. We've got feedback today. So, hey, you know what? It's what we do in Chicago. We manage and survive. And Elias, you are frozen. Well, what I'm going to attempt to do is that it is 10:46 right now, and I know that our session starts at 10:45. And so let me do a little bit of introduction that even as we're going through this particular process right now. My name is Thomas Henderson. I currently serve as the Vice Chairman of the Board of Directors for the 100 Black Men of Chicago. And I also function as the board liaison for our health and wellness initiatives. And I've been for the last 5 years. We have been affiliated with Health Expos for the last couple of years. Last couple of years prior to the pandemic, we were hosting these events at Malcolm X College, and particularly started out with events specifically for the African American male, but felt that we needed to expand this into the full aspect of the entire family. So we do appreciate that we have as our guest this morning, we have the Illinois Psychiatric Society and members that are affiliated with it. And I know that everybody's not on right now, but I am going to just start with the introduction of who will be joining us on panel. And just as we've had to be able to try to understand how to do this, we may have to switch some presentations around as we get people on the line. So I'm going to tell you exactly who we're going to have as a part of us. And as they're working in the background, trying to get them on, we want to talk about this very important topic. Sometimes this topic is very taboo in the African American community, being mental health. We know about colon cancer, we know about prostate, we know about cervical cancer, we know about a number of things that are probably morbidity issues within our bodies, but then we don't place that same emphasis upon those things that affect our minds and our mental health. And that's the reason why we're so excited to have members of the Illinois Psychiatric Society to be a part of us this morning. So our guests that will be joining us, and if they're not all on the screen right now, will be Illinois State Representative Maurice West, who is a part of the 67th District for the state of Illinois. We will also have Dr. Steve Weinstein. We will also have Dr. Martins Adioye. I believe I pronounced that right. I hope that I did. Dr. Jada Johnson and Dr. Abdi Tinwala. And I hope that I pronounced your name correctly as well. So I'm so grateful to have each one of you all here as a part of our panel discussion this morning. As I started out, this is a very, very critical topic for our community. I know that this is so much near and dear to me that as I open up the news every single morning or even in the evening, I see so much that's happening in our African American community that we know that there's something that must be going on as it relates to the mental health of our community, whether or not it's people killing babies, whether or not people are hurting their family members. So we know that something is going on. So I'm going to ask Dr. I believe Tinwala, if you kind of like just open it up for us and just kind of like just give us an overview of what you're going to be covering, or Dr. Weinstein, if you'd like to do the same. I'm just going to kick it over to you, and let's just hope that those that who will be joining us this morning will be a part of this robust conversation, and we'll continue to monitor the chat as we think that there will be some important questions that go forth. So good morning.
Well, good morning, and thank you, Thomas, and thank you, 100 Black Men. I want to mention that we're hoping that two of our presenters will be available. Apparently they're seeing us, but not able to get onto the platform. But good morning, I'm Dr. Steve Weinstein. I'm a psychiatrist and the president of the Illinois Psychiatric Society. IPS is a community of over 1,000 psychiatrists in Illinois, and we are committed to speaking about the importance of mental health. And we are deeply honored today to be part of the health fair and to have that opportunity to speak to you. The title of our presentation is Mental Health Matters. And in the next 45 minutes, we'll be discussing issues around getting mental health services and why good mental health is so important. Our presenters include a special guest, who I hope will be on momentarily, Illinois State Representative Maurice West. Representative West represents the bold and vibrant 67th District in Rockford. This past summer, IPS met with Representative West, heard his powerful message, and knew others should hear it. We also have 3 physician presenters for you. We have Dr. Martins Adeoye, who is coming on now. Hello, sir. Good morning, Martins. He is a psychiatrist certified to treat children and adults. Dr. Adeoye is president and CEO of Elemental Center. He will be discussing biases in mental health. Dr. Jada Johnson is a psychiatrist certified in the treatment of adults and children. Dr. Johnson is chairman of psychiatry at Advocate Illinois Masonic. Thank you. Dr. Johnson will help us think about the difference between just having a bad day and when we need to seek out mental health support or treatment. And finally, we'll hear from Dr. Abdi Tinwala. Dr. Tinwala is president-elect of IPS. He is a specialist in forensic psychiatry and medical director of behavioral health at Anthem Insurance. Dr. Tinwala will provide some important concluding remarks. Again, we're grateful and thankful to be here, and we'll start off with Dr. Adeoye.
Hello, good morning, everyone. I'm trying to share my screen, and I'm so excited to be here. First of all, it's just to thank the organizers of this event. It's just amazing that you guys are able to pull this together, and there's so much we can learn from each other as we move forward. Of course, I'm Martins Adeoye. I've been in Chicago for a long time, since 1993. It's also good to acknowledge contributions of all the psychiatrists that came before me. You know, I did residency fellowship at UIC, and I've worked at Community Mental Health Council, very close with Dr. Carl Bell. I also want to acknowledge him, and God bless him, and God bless his soul. He was one of my mentors. As I quickly start, I'm going to see if I can quickly share my screen here. And I'm not sure how to do this, but if you can see this, this is the slide of what I have this morning. We're talking about understanding cultural biases and bias in itself when it comes to all of us as human beings. The summary is to look at sensitivity. What does diversity means? What are biases, and what are the domains of wellness that we all need to have and share if we want to stay strong and be mentally true to ourselves? Well, my main objective for this brief section is to focus on how do we understand mental illness? What are some of the sensitivity issues that we may have? What is empathy? What are biases? When do we ask for help? And when is there healing for all of us as practitioners, as individuals, and as part of the community that we all belong to? Just to quickly go over the historical perspective of mental health. We understand the history of psychiatry as far as psychopharmacology when it comes to Black patients, or when it comes to minorities within even the United States system. There are also different ranges when it comes to psychotherapy, getting therapy, and understanding what therapy is. Most importantly is the fact that we do not have enough practitioners within the community just to help people. There are not enough opportunities out there for people to go get help. And at the same time, there are challenges to get the help. The other part is the quality of care that sometimes is given. So all these are challenges that we're still dealing with in this age. Now, quickly, I'm trying to rush these slides, but we have just a few minutes to go over everything. Now, when we use the term, a lot of us use the term sensitivity, but sensitivity has to be appropriate too. And this is just to share this with everyone, especially if you're just going to use it loosely. It has to be appropriate for the behaviors and the conscious understanding of respect and awareness to issues of diversity and inclusion. So please, as we look at minorities within the United States concept, and we talk about being sensitive to communities, being sensitive to ourselves, being sensitive to individuals, it's important to make sure when we do use it, it's used in the context of being appropriate and used with respect so that we can all communicate and understand each other. Now, in most cases, when we talk about diversity, most people always think of race, but there is diversity when it comes to gender. There's diversity when it comes to sexual preference. There's diversity when it comes to age. There's diversity when it comes to religious and spiritual affiliations. And there's diversity when it comes to languages. And all these are experiences that we as Black people have and we share. And now just really briefly, just to quickly mention this when I do these big lectures, there is a difference between culture and your customs. Culture is a different set of practice that changes over time. For example, the culture of Black people that existed maybe 10 years ago is probably different from what is happening now. Now, there's also something called customs and beliefs. The customs and beliefs usually do not change over time. In fact, there's going to create a lot of conflict if we try to change someone's customs and beliefs. Now, while we're dealing with all the cultural issues, the customs, the beliefs that we all have, what we do need to understand for ourselves is biases. What is called a bias? A bias is something that is defined, and there are a few people who have done this research. There was Mazarin, Banerjee, and Tony Greenwald. Which started quite recently, was in 1995, and they came up with understanding the biases and stereotypes that we have. There are two types. One is implicit bias. The other one is explicit bias. And this is important once you understand all the issues that we're dealing with now, as far as mental health issues, as far as the social issues, as far as even in your own businesses, in your life, at school, in educational setting, in different settings, wherever you are, you need to understand, especially if you're going to be a strong practitioner, a strong individual within this context of just being able to access care. Now, implicit bias is usually unconscious. Now, when I say this, I mean all of us have our own implicit bias or biases. And typically, when it's coming out, that's when you start dealing with issues of being stereotyped here and there. And please, in giving this lecture, this brief thing today is just to say that we all have our own implicit biases. Now, the other part is the conscious type, which is the explicit bias. This is when it's intentional and, of course, it's controllable. Again, this is not to say, oh, this is maybe a black, white thing, but it's the idea is that everybody in this room or whoever you're going to interact with, they all have their own biases. And I'll quickly go over why do we have these biases and what's the reason for them. And there are different types of biases that we may have, you know. You could have there's a stereotype, there's the microaggression, there's the prejudices, you know, racism, ideologies, discrimination, you know, cultural competencies. And there's so many different types of biases once you get in detail into it. But the point just to make to everyone is this is something that we all have as individuals. And we all need to understand it and know what to do with it in order to be able to access care, in order to be able to interact with everyone that we see on a daily basis. Most importantly, too, if it's not resolved, it could cause death. Meaning within the hospital setting, within healthcare settings, patients have died just because some of these biases have not been explored, or sometimes, you know, biases do affect care in so many different ways. So going to why do we have these biases? What's the reason? How do we understand our brain? Why should everybody even be able to even navigate through this? Now, remember, your brain works based on associations and generalizations. So meaning the brain is processing so many complex things on a daily basis. And at the same time, it's based on your social cognitions too, meaning you wake up wherever you interact with every day, your environment, your school, finances, everything you're doing, your brain is processing. So your brain is going to come up with a concept that is based on you and you alone. The other part is, for example, just to quickly give a good example here, like at the hospital, there was a white lady who came up to me and said, "Hey, are you a priest?" And I was wearing, the regular coat with all the badge and everything. But the point thing was, earlier on that day, there's also another black priest within the same hospital. So people associate you based on what they know in their brain or what they see. And the same thing goes with police officers, goes with, any other person that you're around at any particular point in time. Now, there's also another thing that helps, that may create more biases for everyone. It's the conditioning experiences that we all have. There's cultural conditioning, media portrayals. So, for example, if all the time you're seeing violence, shootings on the south side, on the west side, all these have a role to play in how people are being stereotyped or are being defined. And also has a role to play in terms of opportunities, in terms of indoctrination and some of the effects that we all have to deal with out there. The other part that is important with biases is bias, as much as it could affect your mental health, it could also affect a lot of things as far as your wellness. So we're going to go over what does it mean when we talk of the domains of wellness. How can we all be healthy and be healed and do really well in society within the context of just being able to just participate and be functional? Most people talk about the 8 domains of wellness, like social. The part thing is there's a spiritual part. You must believe in something. Even if it's nothing, have a good, strong belief that's going to empower you and move you through life. The other part is the emotional aspect. I'm sure we're going to cover that a lot during this brief session. The environmental aspect of wellness is important. You have the financial aspect. And hopefully, because this is under Black men, please, if there's a way you can work on the financial aspect to make sure everybody is empowered financially, it's so crucial. The intellectual aspect is also important. Occupational, of course, you have to, that's where it goes. If you go to school, whatever you need to do, it's important to have all these domains of health. And most importantly, I hope we just don't think of physical alone. Physically, it's important to be healthy, to take care of yourself. So please, as we're defining this and you're understanding everything, this morning should not just be about emotional alone. It should be about your wellness and your health. And there's a strong investment in that for everyone. Now, how can any Black man or woman or any minority overcome some of these biases that you're going to deal with? Biases exist in institutions. It exists even within the concept of the family too. It's not something you're just going to read about on the television. It's something you're going to experience on a daily basis. It's something that's going to affect your mental health. It's something that's going to really impact your ability to achieve those domains of wellness. And most importantly, if there's anything anyone needs to remember this morning, it's your mental health is your wealth. I just want to quickly say that your mental health is your wealth. And in order to be able to have great mental health, you need to be able to stay strong and be true to yourself. So the important thing is when you're dealing with individuals, you have to be able to see individuals as individuals, whether it's your doctor, whether it's the police officers, whether it's anyone that you interact with on a daily basis, because they have biases too. And if your own bias is focused on the stereotypes, you're going to miss a lot of opportunities or a lot of great things or opportunities to even communicate and get to know each other. The other thing is you have to have an active opportunity to work on your own stereotypes that we may have. That could be in different areas of your life. Remember, I quickly went over the slide where there's some indoctrination, there's cultural issues, there are reasons why you have all these biases. if you're not willing to work on those stereotypes, it could impact your growth. It could impact your ability to even access care and access patient important information. It could also impact the ability where you can connect with your practitioners. And most importantly, it's always good to take time to reflect and reflect on other things that may really help your mental health, whether it's relaxation techniques, whether it's connecting with people. When we talk about mental health, please
Dr.
do not limit
Martins?
it just to yourself. Um,
Dr. Martins?
yes, sir.
Dr. Adeoye, we need to wrap up your part.
Thank you. Thank you for the quick. I only have one more slide, but just to quickly talk about the last part of mental health, please, anything that is happening to your loved ones too could affect your mental health, even your friends. So please, most people, when you talk to them, when they hear mental health, they say, oh, I'm not depressed, I'm not doing anything, I'm okay. But that's yourself. What happens to people around you? What happens to other people that you may just run into? So please, it's always important to take this and be mindful. Now, please always increase your exposure and most importantly, practice mindfulness. Thank you, everyone.
Thank you, Dr. Adeoye. Dr. Weinstein, who did you want to bring on next? I know that we have Representative Maurice White. I know you had West, pardon me, that had difficulty getting on the call. So I'm not sure if you wanted him to go on next, but we thank you very much for that excellent presentation on biases that keep us from having access to mental health situation. So Dr. Weinstein.
We'll hear from Dr. Johnson and then Representative West, please.
All right. I hope everyone can hear me. If I see you nod, I know you can hear me. Great. Good morning. I'm Dr. Jada Johnson. Thank you for the introduction. I am so happy to participate in this event today. I am born and raised in Chicago, a product of the Chicago public school system. I participated in programs like this, so it is an honor for me to be able to give back in this way today. I will very briefly talk about how do we access mental health within the African American community. And what I'd like to focus this brief discussion on is how do we know when we need mental health care? Culturally, we have experienced trauma that is still yet to be defined. It is a part of our everyday culture, microaggressions, macroaggressions, financial instability, poverty, lack of education and resources. And overall, the tenet is that if you are of a minority group, you have to be stronger, wiser, smarter, faster than our counterparts in order to get ahead. And that teaches us that the tension, upset, stress, distress that we may feel is normal. It's what is to be expected in our everyday life experience. And I find that this concept is really something that delays the ability and opportunity for the African American community and other minority communities in particular to reach out for help. Because everybody's struggling, everybody's stressed, everybody feels a little sad. So how do you know when it's time to seek out a professional? And what happens when you come to a psychiatric appointment? Many participating in this event today probably know there is a significant stigma within the African American community in regards to mental health treatment. The label is that you are somehow defected, there's a deficit, you are crazy if you need to seek out mental health. And that actually is not the case. The word I'd like to leave with you is function. At the end of the day, how are you functioning? And Dr. Adeoye spoke to this when he spoke about wellness and mindfulness. Are you able to sleep at night? How's your appetite? Are you connecting with family and friends? What does it feel like to go to work every day? These are some of the things that we take for granted in our everyday experience, and we push through. That's the terminology we use. Or you pull yourself up by your bootstraps just to make it through the day. And you go to bed and you wake up and you do it another day. If you were to seek out mental health care, these are some of the facets of life that we like to focus on. You come into your appointment to meet with the psychiatrist. We're going to ask you, how are you feeling? How is your sleep? How is your appetite? And based on your response to those questions, it helps us to understand what's normal and how are you functioning. And again, that's the word that I want to highlight from my piece of this discussion. Think about how you function. If day-to-day function leaves you feeling overwrought, overrun, tired, tearful, stressed out, tense, it may be time to speak to a professional. Some of the things that we hear a lot about are depression and anxiety. But what does that really look like? When we talk about depression, people think about crying every day. Well, that doesn't necessarily have to be the case. Sometimes people are depressed and it shows up in just feeling a sense of fatigue that will not quit. No matter how many, hours of sleep they get at night, every activity requires so much work. They're irritable with their family. They're irritable with their friends. Everything just becomes a means to an end because they can't emotionally connect to what's going on. Anxiety is another diagnosis that we hear a lot about, but I'm not sure we really understand. That constant feeling of worry. How do you differentiate that from some of the experiences that are just culturally become normative for minority communities and particularly African American communities? How do we know when our anxiety has reached the point where there needs to be some intervention? And so the psychiatrist or whatever the behavioral health professional is that you seek out will ask you questions about the amounts of stress, tension that you feel, how that shows up in your life. Does it prevent you from doing things? People have heard about diagnoses of bipolar disorder and schizophrenia, especially because of the platform that mental health has taken amongst our celebrity community, whether it's our R&B artists, hip hop artists, actors. And so questions again that look at how are you functioning? Are you able to maintain quality relationships? Are there dramatic shifts in your mood? Do you have periods of time where you're experiencing things that perhaps other people are not experiencing? And you've gotten this feedback from family, from friends that say, I'm not really sure I understand what you're explaining to me. These could be signs and clues that it's time to consider maybe what I'm experiencing is not normal. And it's time to think about, should I go and talk to somebody? Well, even if you get to the place where you're ready to contemplate seeking out mental health care, then the other issue that comes up is, I don't want to be on mental health medication. And there's a lot of stigma around taking medication to treat conditions like depression, anxiety, bipolar, schizophrenia, whatever it may be. I challenge you with this thought. Just as humans, when we are not doing well, when we don't feel well, we will seek out something to help us feel well. We don't have time in this session to dig into the correlation between substance abuse, addictions, sexual addictions, food addictions. There are all types of ways that we will self-soothe that can actually be very problematic and contribute to some of the ongoing stressors that we see in our community. But I have to mention that here to say, when you're speaking with a professional who's asking you, how are you doing and how are you functioning, and offering medication perhaps to help you navigate, please be open and think about what else you may be doing to self-soothe in those moments. It may be the case when you speak to a mental health professional that you don't necessarily need medication. Perhaps you just need a listening ear in an objective space. You need to have therapy. Again, I am so excited that the conversation of mental health has gotten to the kitchen table for most homes today, and people are more open and willing to access mental health care and therapies particularly, which really can be so impactful in helping us to understand how to thrive as opposed to survive, because that's really what it comes down to at the end of the day. We figure out how to survive, but are we thriving? In the essence of time, I wanted to keep my comments brief, but again, I hope that gives a general overview of what you might experience should you decide to reach out for mental health care, some of the questions that may be asked, and some of the things that we consider when we're helping you understand, is it normal what I'm feeling? Thank you.
Dr. Johnson, I think that's excellent presentation, very concise. Two main words that we walked out of that presentation with was normal and function. So thank you very, very much for that. And I believe that Representative West is going to kind of give us more of a practical experience, because we like to be able to hear that although we've gotten the information about biases and function. Representative West, how would you like to chime in to kind of like talk about your actual experience itself?
Well, Dr. Henderson, Dr. Weinstein, everyone who's on this call, thank
Dr.
you so much.
Henderson, no, I will not take that. That's not my credit. So I am just.
Okay, apologies, Brother Henderson. And thanks to all of you who are on this in this space on this session. I'm Representative West from Rockford, Illinois. I'm a proud state representative here, and I'm proud to say that I'm a preaching politician. I'm an ordained minister in the Churches of God in Christ of the Christian faith as well. And I often tell people, a lot of people come to me and say, "What led you down being a mental health champion?" This is my second term. I'm on the mental health committee in the House, and I've carried a lot of legislation and supported a lot of legislation that's focused around mental health. And when people ask me why am I so adamant and passionate about mental health, I boldly and unapologetically tell them, don't let my titles fool you. Don't let this three-piece suit fool you. I'm a preacher who suffered from suicidal ideology within the last 5 years of my life. Helping them to understand that mental health is, and I would dare say, more important than our physical health. And I'll speak on that in a minute. One thing that we say in the church, and I'll say this to Dr. Johnson, you was preaching all up in my message. And I appreciate everything that you said. And you mentioned how it's exciting how this is mental health is starting to become a kitchen table topic of discussion. And I would dare say that it's time for mental health to be a topic of discussion within the church as well. I can speak on the Christians within the Christian faith. That's what I'm a subject matter expert in. My father's a pastor. I'm a preacher as well. And I will tell you that growing up, talking about mental health was not in the way that we're talking about it here. Is not supported. It's not popular. Your mental health has a direct correlation to the attack of the enemy in the church. And I know from a firsthand knowledge that it's deeper than that. Just a minute ago, I said mental health is more important than physical health. In my role as an ordained minister, I had to bury a lot of members within my church. And some of those members, because I was closely connected to their issue that led them to their, I would say, untimely death, they would receive a clean bill of physical health from the doctor. But the doctor always said, you have to want to get better. And if they don't have that strong mental health, I can think of two of which the doctor was baffled to how they passed away, because everything was okay with them physically, but it was their mental health that couldn't get to the place of healing. And it's time out for us to stray away from this topic of discussion within the church. It's time out from us in the state taking away funds and not making mental health a top priority within our state. I strongly believe that if we invest more funding into the mental health, especially in the underserved community, in the Black and Brown community, if we put more funding not just to the resources, but to combating the stigma, it will help with other issues that we're having in our state. And that is where we need to focus our efforts. Dr. Johnson, you also mentioned, and I always say this everywhere I go within my state capacity and in my ministerial capacity, that over 700,000 people died from this virus worldwide, and yet we are here. The 29 of us, we are still here. There's a reason why we are still here, and so it's imperative for the legacy of the people who died from COVID that we be bigger, faster, braver, stronger than we were before the pandemic. And it's imperative for subject matter experts, for the doctors in session for those of you who your passion is mental health. It's imperative that we ensure that we break the barrier, that we don't just end the stigma. We have to tell our people that there must not be a stigma, because with COVID it brought more mental health issues within the Black and brown community, just as well as any other community that's out there. And we have to be in a space to talk about this. We have to be in a space to understand that crying is not a moment of weakness. We have to be in a space to create that environment where people can and are willing to talk about their mental health issues. They're willing to express what they've been through, understanding that it doesn't mean that they're weak. It doesn't mean that they're sinful. It doesn't mean that they are not close to the God they serve. It means that we are human. And the things that we've gone through are going through on an individual basis, it matters to our, not just our mental health, our physical, our physiological, our emotional, our financial, every single facet of our health. Our mental health plays a key part in that.
Representative West, I want to thank you very, very much for that. I know that we have a couple of other speakers, but first of all, let me thank you for your transparency. I think that your transparency is very godly in terms of sharing that information in terms of your own personal struggle, because most times people want to be able to know, is somebody real that is lived through this that can relate to me as well too. And just some additional information, so you'll have that, and we'll go on to our next speakers. I'm aware of a conference that I attended a couple of years ago that is actually going on this year called the Healthy Church Conference, and that is actually goes on by Dr. Pernisa Seal out of New York, and that's a conference that they hold in South Carolina. And I'd like for you to be able to look them up and to be able to introduce a lot of your pastor friends, because mental health is a part of what they want to ensure that is happening within the church as well. So thank you very, very much for your presence on today. So Dr. Weinstein, I'm going to kick this back to you. I know we have a doctor yourself, Dr. Weinstein and Dr. Tinwala still on here. And I know that we got about 10 more minutes left. And I want to make sure that we give you fair enough time to add to this robust and fine presentation.
Well, thank you. My part is done. We are now, we'll have Dr. Tinwala, and I'll say we failed to send over our slides to Eric earlier, so we're in the process of trying to figure out how to do that. But in the meantime, Dr. Tinwala will begin with his comments.
You're on mute, Dr. Tinwala.
You're muted.
Okay, that would help. Thank you, Mr. Henderson and 100 Black Men, for allowing us the opportunity to come and speak with you regarding mental health issues. We really appreciate this opportunity. I had a bunch of slides that I wanted to project. I think they are working on getting those slides on. But let me see if I can, nope. I might be able to.
Doctor,
can you guys see my slide?
It's trying to come up, so it's coming. But if you're able to speak to them as they're loading up, that would be fine for the interest of time, Dr. Tinwala.
Okay, I can just go ahead and get started. So I want to start my presentation with giving some statistics on mental health. 20%, almost 21% of the US adult experienced mental illness in 2019. So that's roughly about 51 million population of the US that experienced mental illness. And this basically comes out to be 1 out of 5 adults who had mental illness in 2009. And when we are, so this is of any mental illness. Now, when we are looking at some serious mental illness, such as schizophrenia, bipolar, major depressive disorder, that is about 5% of the US population experienced serious mental illness in 2009, which is about 13 million people and represents a ratio of 1 out of 20. Now, keep in mind, these numbers are from 2019. This is pre-COVID. And as almost all the speakers have said, the numbers have gone significantly high after COVID. In terms of the prevalence, I'm sorry, guys, I'm hearing an echo. I think somebody needs to mute. Thank you. In terms of the prevalence of mental illness amongst Black and African American men, the number is 17.3%. So it's not as high as the white population, but it's still significantly high. But what we do know that the serious mental illness, the percentages rose for all African American, for all ages of African American and Black men between 2008 and 2018. So there's been a steady increase in serious mental illness between 2008 and 2018 for all ages of Black and African American people. More interestingly is who actually gets treatment, right? So we know that all of these people are at risk for any mental illness and serious mental illness. Who are the people who actually get treatment? And there was a study done which showed out of the 51 million people who are affected with mental illness, 50% of the white population actually seek treatment, while only 33% of the Black and African American population get treatment for their mental health problems. So I think that is pretty, that speaks volumes in terms of access to care and the barriers to care that some of my team members have been speaking about. The other statistics I would like to share, which are even more interesting, is the suicide statistics for suicide rate. I think some of you guys might know this, that the rate of suicide increased from 1999 to 2018, and then it went down in 2019. So I'll give you some numbers. In 1999, the suicide rate was 10.5 per 100,000. It went all the way up to 14.2 deaths per 100,000 in 2018. This actually accounted for a 35% increase in the death from suicide from 1999 to 2018. However, in 2019, the death rate went down from suicide to 13.9. Now, I can see that because of COVID in the last year and two, I expect that number to go up also again, unfortunately. What was most striking to me is even though the rate of overall suicide rate went down in 2019, the suicide rate for Black male youth in this age group rose from 12.2 to 17.9 per 100,000 individual in 2019. That basically accounts for an increase of 47% of suicide death rate increase from 2013 to 2019 for the young Black males. So as you can see, these numbers tell us a very, very grim story, and we know that mental health matters, and that is why we are here to talk about it. My next slide, and
Dr. Timwala, let me make it clear for you is that we are not able to see your slides, so we are only able to hear what you are presenting at this time. And also just to be mindful of our time, I know that we are getting to the end of our allotted time, and I apologize for that. I'm not sure whether or not the mechanics of this is going to cut us off at our end time, but please continue.
Okay, thank you, sir. I appreciate that. So really quickly, moving forward, I'm going to go a little bit faster. So what are mental disorders? Mental disorders are conditions that affect our thinking, mood, and behavior, which is a result of a chemical imbalance in the brain. People always ask me, what causes mental illness? So there are a number of factors that contribute to mental illness, such as early adverse life reactions, such as trauma, history of abuse, witnessing a violence. Also experiencing related to ongoing chronic medical conditions such as cancer or diabetes. And then we have genetics. If you are predisposed and if you have genes for mental illness, you are more likely to exhibit mental illness. And lastly, the use of drugs and alcohol can also contribute or exacerbate your mental illness. Now, some of the speakers have already said before, physical and and the mental health both are equally important. For example, if you have depression, it increases your likelihood of getting physical conditions such as stroke, diabetes, and heart disease. Similarly, the presence of chronic conditions such as dementia and Parkinson's and stroke can increase the risk for mental illness. There's also the risk of self-medication with drugs and alcohol. And finally, if you are suffering from mental illness, this not only affects you, but affects your relationship, your employment, your legal status, and the works. So we need to make sure we are addressing mental illness. And how do we address mental illness? I think I've got about 6 bullet points and I can try to go through them quickly. We need to strengthen access to and delivery of mental health services. Dr. Johnson had talked about medication and therapy, and I totally agree with her. We don't need medication as the cure-all for everything. Sometimes people with mild to moderate depression and anxiety respond much better to therapy, and that's actually the treatment of choice. It's only when we are going into the psychotic disorders when we do need the medication. Secondly, addressing the social determinants of health, and I think you guys might be familiar with the terms SDOH, such as housing, food, employment, education, transportation, and economic stability. Making sure that our patients and our members have access to good housing, good food, have a job, are able to get a good education, are able to go to their appointments and to the pharmacy to pick up the medication, and don't have to worry about money in terms of living everyday life. This would make their life so much easier and help them, live a stress-free and anxiety-free life. Also, we talked about promoting connectedness through faith, social, and community engagement. These are very important. I myself come from a culture which is Indian, where the social and community engagements are very important to us. And I can totally see that across the diverse cultures that we have in US, I think the social and community and faith engagement, very important. We also need to create a safe and protective environment by reducing access to lethal means such as guns and drugs. As we know that, I think one of the speakers mentioned that guns can be used in homicide, but we also forget that those same guns can be used to complete suicide. And as I told you, the rate of completed suicide amongst African American youth is increasing. So we want to be mindful of reducing the access to lethal weapons. Finally, the last 2 points are to teach coping and problem-solving skills and develop parenting skills and family relationship programs. And lastly, we need to identify and support people at risk through crisis intervention. And in my last 2 slides, I'd actually provided some phone numbers for mental health crisis hotlines and also some websites for mental health resources. So if anybody is interested, please follow up with those links and those phone numbers. Thank you so
Dr.
much.
Tangwala, thank you so much for that. And because of the fact that we weren't able to see your information, if you could type those phone numbers into the chat, that's very important that we do have access to that resource information. In fact, Dr. Johnson, I'm going to ask you to address this question that's actually in the chat, kind of like as we're closing out. It says, how can we encourage the mental health medical community to produce a social media platform that addresses the Black community with mental health knowledge and information the same way Twitter or Instagram reaches communities? You did a very comprehensive explanation. I think you got a very practical way of addressing that. So how would you address that?
Yes, I think it's an excellent question, and it's an opportunity that we have within the mental health medical community. I think we're there. You're going to start seeing a lot more through social media focused on mental health. Right now, some of the access, because of the exposure, really lives within our celebrity community, and I mentioned that. But there are organizations, for example, like NAMI Chicago, that has a wealth of online information. Even through our Cook County mentalhealth.org, there are so many resources and information. When we talk about platforms that allow discussion, chat, likes, posts, You have some individuals who are out there doing it. I do think it's an opportunity for us to get together and make it so that it is presented in such a way. I can look, I don't know if there'll be an opportunity to maybe leave some resource information at the end, but there are a few podcasts even that I follow that are conducted by psychiatrists, and they talk about these mental health issues, statistics, stigmas that affect our community. But I think it's a fantastic question, and I think we're doing it. So I anticipate you'll see a lot more in the social media platforms very soon.
Well, thank you very much, Dr. Johnson. And Dr. Tinwala, thank you for the resource information that you put there in the chat. And coincidentally, he did put in there NAMI, just as you had mentioned, Dr. Johnson. So thank you very much for that. This has been such a great platform. And even as I had initial discussions with the members of IPS, I knew that this would not be enough time to address this important subject, which is, I said earlier, has been very much taboo in the African American community. And as Representative West said, been more taboo within the church. And I think that as we began to start taking off the leaves, or we start taking off the covers off of what's happening in our community by addressing people like yourselves, we do appreciate what you brought here today. Dr. Adeoye talking about the biases and the stigmas. You talking about, Dr. Johnson, talking about the function, the normality, because that's something also very important that we want to know. How are you doing? Are you sleeping? Are you being physical? Are you being honest with your family members in terms of what's going on? Dr. West, well, Dr. West, you call me Dr. Henderson. So Representative West, just to be able to say, just important that people who are your level, both from political and religious persuasion, to be able to hear that transparent message from you. Thank you so much for that. And then Dr. Tinwala, thank you for having such a very robust and important information, because statistics are very important for us to be able to know where we have been, whether or not we're making progress, or whether or not we're going backwards. And thank you for the resource information that you provided. So Dr. Weinstein, I'm going to actually put this back to you if you have any comments to close us out for today.
My volume has been scrambled, but I think you said
Oh,
you're done.
I think that you are having some sound issues. I think
Yeah,
that's
that's
why you, okay. He wants to mention, unless you're, because we can't hear you that well.
Okay, I'm not interested in saying perhaps I'm not.
Well, we'll allow you to go back on mute. So I'm just going to be able to state what you've indicated in the chat, that he wanted to mention a community resource, which is Coffee, Hip Hop, and Mental Health at chhamh.com. So I'm about coffee for sure. Hip hop is okay, but more so mental health is going to be a part of all that we do. So let me just say again to each one of you all as panelists, thank you so much for availing your time to be able to share the important services that you provide. And I'm just going to end this by saying it's okay to not be okay, for us to be able to know that it's okay to share with others when we're not ourselves, when we're not functioning normally. So thank you so much for your time. Thank you for your commitment. Thank you on behalf of 100 Black Men of Chicago for being a part of today. And we hope that you'll enjoy the rest of your day. Thank you very much to all of you.
Thank you.
Thank you.
Thank you so much.
Thank you.